All right, so we're going to be talking about birth during this pandemic. There's a lot of changes going on, isn't there?
Yeah, so much all over the country.
And the feelings that are associated with it, not to mention that we're pregnant. If you're pregnant, you're like already a bunch of feelings, and you're already a bundle of hormones,
Yeah.
nerves, and now you have this added on to all of it.
Yeah. So if you're at the end of your pregnancy and you're wondering, is this going to be over? Is it going to be back to normal? Or am I going to be going into the hospital with these different policies that are new? What are those policies? Some women are saying, I'm going to go somewhere else, and we can talk about that in a minute. And all of that's coming when you're like trying to nest and you're trying to have your plan in place and know what you're going to do and you know pack your bags if you're going to go to the hospital and
And I mean, you're just
have that relationship with your
you've
provider.
had such a impact, and you've been studying so much with birth practices and doula training, and you're currently just finishing doula training, and it's just amazing to see the difference now, how people are approaching birth, and they're going into birth where they might have had fear before. I know I did. Whenever I was having Ethan, I was uncertainty, and it's the one thing that I work with a bunch of type A personality women. Just want to have that plan, and they want to know exactly what's going on, and so you already have that uncertainty. But now you have that extra added uncertainty of, okay, is everything going to change? Am I going to be in there by myself? Am I
Yeah.
going to be alone? Like, is this all going to be done by the time that I have my baby?
Yeah.
But you just don't know.
Yeah. So some of the hospital policies throughout the country right now, they're trying to limit the exposure. So they're saying no visitors. And so people are like, okay, that's understandable. We don't want people to get sick. So then they think about it and they're like, no partners. Oh my goodness. I'm not
Yeah.
okay with that. That's scary.
And
And there's
those feelings
also,
are valid too. Those feelings
yes,
are valid. Like, it's okay to be like, oh my goodness. Some people, they're like,
yeah,
that's just, I should be a part of this, and like, I shouldn't have these feelings because it's all about the collective. Having those feelings are okay.
yeah. And also that I think there are some women who are like, okay, that's cool. My husband was gonna stay home with the kids, and that's valid too. It's okay if you're not freaked out.
You could be on both ends
Yeah,
of the spectrum. You could be totally freaking out and you're like, meh, that's okay. Or you could be,
yeah,
whatever it is, and that's okay. Those feelings are valid. And as we dive into these changes, um, it's important to keep that in mind. These might be scary changes. These might be, oh, okay, I can deal with that. And that's okay.
yeah.
As long as you're able to find those changes and you're able to find exactly, what you want and are educated in those things.
Yeah. How can I make this work so that I feel confident and I feel safe and I can come away with this and not be scared or not have bad feelings about it looking back? How can I embrace this in the best way?
Because the pandemic isn't going anywhere. Sadly, we cannot change. That is one thing that's
Yeah.
just non-negotiable. It's going to happen. And hospital staff and people are trying to make sure that people are safe, and we're aware of that, and that's the most important thing. And as expecting mothers start to find their place in this, they also need to be aware of the changes. So I know that there's changes that are happening and that are being instituted, but they're not the same across the board. Is that correct?
Right. That's right. So, all over the country, they kind of vary, and there's different state interventions. I know New York has said something about this, and we can talk about that in a minute. But then, even within just the same city, just hospital to hospital, these policies are different. So, the limiting visitors. Okay, great. We're all on board with that. We're gonna be sad to miss, having our mom with us or having our whole family wait out in the waiting room. I can understand that. And then the policy kind of narrows down, and they say, well, you can't have a doula. And you say, wait, but I've paid for this person, and I've had this relationship, and I had this plan, and I know the statistics, and I know that they reduce this and that, and they increase positive birth outcomes. In some places, they're saying, yeah, this is a birth professional. They're there. They don't kind of other people saying, no, they're visitors. They can't be there. Okay, we can figure out how to work around that. We can do it. We can do it. Some places are saying you can't have your romantic partner or the dad or whatever other XYZ. You can't even have that one person there with you. That person's going to miss the birth. You won't have that support. And some women are just like, I can't do that. That's not okay. I wasn't planning on my husband to go watch the kids because we don't have family. My husband has to be there. He can't miss,
Which is understandable, right? You want that support. You want that partner there. That's
yeah.
understandable.
Yeah, we know that, continuous labor support does increase positive birth outcomes. So healthier mom, healthier baby. And I want to be very clear that we're not talking negatively or have any bad feelings towards doctors or nurses or other medical professionals who are trying so hard, and they're working so hard, and they're sacrificing
and those
so much.
Those policies are in place for a reason. Those protective policies are in place for a reason. And I wholeheartedly stand by those because I understand they're trying to lessen the chance, right? We're trying to flatten that curve. So that's the point.
Yeah, that brings me back to New York. So there was, a big online thing where New York said, no, women do not have to labor alone. You will not labor alone. You won't be alone. So that's statewide. That's great for them. I don't know their stance on the doula, if they're considering that a birth professional or if that was included at all, but that's a step. That's good. I know there have been lots of petitions going around about including partners and professional birth support like doulas, and I've seen a bunch of them for different states. I know Michigan had something passed based on a petition that happened. So women and women's health activists and all of that, they're all saying we've got to do something. We've got to figure out how to have the most optimal flattening of the curve, but also we don't want to lose all of the benefits of the continuous labor support, all of the mental health benefits. We know that having people there with the woman the whole time, not just nurses, they're so stretched out and they can't stand with the woman the whole time. So what are they going to do? What if there's an emergency? What if there's no one there to call for someone? So aside from they're like, oh, it's just the romanticized view and you just have to suck it up. That's not true. There's so many. The World Health Organization, WHO, even, they're like, nope, that's not okay. No, we're not doing that. So back to women saying, who says this? CDC says this. My state says this. My hospital says this. I don't know what to do.
And that's so much knowledge and information. I'm an advocate. You're an advocate for knowledge, empowerment, being educated, going forward and having a plan and being educated in your options, right? But then to this state of overwhelm, you're already, tired. You're already like, just get this baby out of me. But now you're like, wait, what's going on? So state of overwhelm. And I'm curious if hospitals will kind of start doing the whole thing where as we get more tests available, if they'll start screening the parents, the providers, things of that nature before they go into labor and delivery, and just to screen that virus. That way maybe that can mitigate some of those potential concerns. But it'll be to see how that develops as well.
Yeah. And before we get too much farther, I also want to point out the World Health Organization says that mothers and newborns are not to be separated.
Yes.
Even if one is positive for COVID-19, they're not to be separated.
Yes.
The CDC says they need to be separated and they needed to be treated as infectious individuals.
Yes. And that's frustrating. At least, I think about it, and you are too. You're thinking, oh my goodness, what if that was me? I just gave birth to this tiny human and I want to hold this, the golden hour, right? That's just, there's so many things that this is going to impact. And as we're trying to be cautious and flatten the curve and be very, very aware, we also have to think about the mom and the baby. This is going to have lasting effects.
Oh yeah, long term.
Yep.
Mental health, bonding, feeding preference. We know that can seriously impact the breastfeeding relationship and getting breastfeeding established.
Yes. And so now women are kind of responding. They're like, okay, so now all these changes are being put into place. Now what do I do? Do I go for just suck it up, buttercup? And this is this is what's going on. This is what I have to do. Are there options? Because somebody down the street, they're saying that their hospital's saying my partner can be in there if I'm delivering there, or my doula can go with me. So, my hospital's saying this one's saying this. And then you got down the street the other way, she's having a birth at a birth center, or the other side of the street, that lady's having a home birth. So now they're like, okay, so here's the changes that are happening. Do I need to change? Or do I just go with the flow? And that's a hard place to be too, because we're not saying that one's better than the other. It's just now you're compounding those changes, options, and you don't know if you have the options, if you don't know if you can change. It's just, there's a lot going on.
Yeah, I think a lot of people before, they're looking at options that they wouldn't have considered for themselves for this time, for this pregnancy. And now they're saying, maybe I need to go to a birth center, or maybe I need to have this baby at home with the midwife. And I know that's going on. I know birth centers are saying, we have an influx. Midwives are saying, we have an influx of women.
Yeah.
They're looking at their options and they're saying, that hospital experience that's going on is not for me. And I can't do that. And I'm going to do something different.
And they want to be too. I know I've been speaking to a couple of women who are like, I don't want to go into that hospital because it could be more exposure, right? As he was literally just on week 2 of quarantine, I had COVID. It sucked, and I don't wish this on anybody. I'm just now getting my voice back. I'm just now feeling somewhat human. I would not want, any mother, baby, family member to get this, and that's a worry about women who are going into hospitals. They're like, is this going to be worse? Is this going to be more exposure? Do I instead turn to an alternative option?
Yeah, even going in for prenatal appointments, they're like, do I cancel? Is it, can I do maybe an over the phone?
Well,
like, how do I get my labs if I do that?
Yeah, exactly. They were saying that they were changing the policies on how many visits women should have now, which is great because then that's limiting exposure, right? But it calls into a bunch of different questions. Did we actually need those extra appointments? How are we going to get the quality assessments that we need if we're doing it's just a whole new can of worms. But I'd love to touch on, because we both know people who are in the home birth community or birth center community, and also hospital, because I was hospital birth. You did home birth, which is both beautiful. So now people are having to go into this with an educated mindset. Let's talk about what options they have right now.
Yeah. So first I want to say that not everyone has this other option. I have already spoken with multiple women, or typed on Facebook, had conversations with women who they do want to seek out these other options, and they've come to the conclusion that they're not low risk enough. They do need to be in the hospital.
Successful. And I think that's the important aspect of our conversation here to highlight.
Yeah.
We want to make sure that people are aware, and we want to make sure that they know that they have options. And we also want to make sure that they're educated in their own situation. Because just because somebody else might be able to change their options, and we advocate for that if that's what they would like, they also need to be aware of if they can safely.
That's one of the reasons I feel so strongly about making sure that no matter where someone's having their birth, that it's done most optimally for them, and making sure that just because I can go somewhere else and do something else, and so I don't have to worry about that or whatever. I want to make sure that the other women are taken care of too, and that they're able to have a, the best experience for them.
Exactly. And so as we look at these different options, some women, they're going to be more high risk. And so they're not going to be able to look at these options and be like, oh, this is something that I can do. But say we're talking to the women who they've been cleared by the doctor, they're not high risk. And they've been to their physician, they're like, hey, this is not what I had in mind. This is not what will suit me best for right now. And I'm going to be looking at other options. What are the options and the resources that they have so that they can begin to learn?
Yeah, so there's a lot. There's a lot. I can just, I'm picturing myself like coming into like being like a late pregnancy and having this plan and then having to learn about this whole other world that I hadn't been in before. And now there's like, whoa, there's a lot.
There is.
So there's having your baby at home. And that's where you see your midwife prenatally, you go to their office, and you have your prenatal appointments. You get your regular labs, you get all of the prenatal care, and typically those visits are like 45 minutes to an hour. You're the only person there regularly, so that's a plus for no exposure. And then, so those are the private midwives aren't associated with the birth center. And there's also midwives who work and operate out of a birth center. And some of those birth centers, they don't offer home birth. They won't come to your home. Some of those birth centers also do home birth. So you can work with that provider either in the birth center or at home. And that's kind of the bulk of things that we can categorize here and here. Getting into the nitty-gritty, there are some different ways that midwives certify and find their education, and that's a whole thing that could be a whole nother conversation. So just to say, there's, you know, if you have a preference, maybe start looking into that and seeing the different types of education. And yeah, that's a whole other thing. We'll get into that another time if you want to.
Well, and that's good, but it is good to know that there's different types of midwives. However, you know, now whenever people are looking for options, what are some websites, what are some key resources that they could go to if they're like, okay, we want other options or we want to discuss with our doctor?
So the best thing, different midwives. So if you're thinking,
say that
really
again, I think it cut off. You're going to have to say that again, sorry.
Okay. The first step would be to have some consultations with midwives. So to get there, maybe you need to get on Facebook and find your local like home birth midwife group. So for Tulsa, it's like Tulsa Home Birth Mamas or Moms or something. And there's, you know, the midwives in the area, they're all there, and a ton of women who've had home births or birth center births, they're there, and they're a great resource for, hi, I'm new here. I don't know what's happening. Help me, please.
Just to clarify, so think of it in steps, because I just want to make sure that people know. So you have a hospital birth, you know, you're in the hospital. Birth center, you have a little bit more of, you know, you're going to the birth center. Sometimes there's a lot of times there's a midwife that could be even an RN as well. There's probably doulas, there's going to be additional probably support staff, and you're in a separate place other than your home. And then you have a home birth where you'll have a midwife, maybe they're an RN as well, and then you might have doulas along there. So those are like the three ones we're discussing right here. Okay.
Yeah, thank you. See, there's just so much. I forget and assume that people know things that
no, you're doing good.
Isn't common or isn't, you know. So the first thing is to just like figure out what's in your area. In Tulsa, we have a few midwives who are private, and then we have 3 freestanding birth centers and they all have their staff, they have their midwives, and 2 of them will do home births, 1 of them does not. And then we have a lot of doulas. We have a really great birth community, and there's a lot out there, which is kind of overwhelming. If you're at the end of your pregnancy and you say, I want to do
Right.
something, what do I do?
Well, and if you need to, people can start to reach out to friends that maybe you know, or you just reach out to a couple people on the page that you find in your area. Just start there, and that way, knowledge is power.
Yeah.
Yes, we can get overwhelmed with that knowledge, and that's completely understandable. So don't beat yourself up and, need to know all the things. Just start with the basics. Like you said, perfect example. Reach out to your local people, because there's probably going to be several that you didn't even know existed. And that's the beautiful thing about social distancing. It's forcing more people to find people online. And it's an incredible tool. So use it, utilize it. It's there for you.
Yeah. And so definitely pre-coronavirus, I was running into a lot of people who kind of assumed that they might be higher risk than would be okay.
Yes.
Now, during coronavirus, it's women saying, I really am too high risk. This is really sad. I'm unhappy about this. So definitely consult with a couple of midwives. Like, you would do that anyways.
Exactly.
So there's kind of introducing some new stuff. If you're switching late in your pregnancy, your kind of what you're looking for is a little bit different than, or the questions you would ask are a little bit different than if this was your plan from the beginning. And that's, because of some factors that we can talk about in a second. But reaching out saying, I'm interested in this as an option. I have some, questions, some hesitations, some concerns, whatever it is. Let's have a meeting. And then at your meeting, they're going to say, okay, what's your health history? What's going on? Here's what I do. Let me answer your questions. So I think it's really, really, really important for people to talk to some providers, talk to the different couple of midwives, talk to, just be open with them and saying, I don't really know XYZ. Like, I'm kind of staring into this big empty space and not knowing what questions even to ask.
And that's okay too, because it's just if you were going to your doctor or something like that, like you wanted a good fit, which is a whole other conversation for another time. But you can go in there and be like, okay, so I have these questions, but then also tell me what else I need to know. Like, is there anything else that I need to know if I'm going into this late in my pregnancy? Because midwives are great. They will let you know. And if you are unhappy with that one, then go and find another one. It's just gonna move that process along, but it's also a great place to start. Because as we go forward in this pandemic time, being armed with that knowledge and starting you down this road with some guidance instead of being like, I'm just gonna do this, it's just gonna happen. And I've read great things, or I've read horror stories, but I'm just gonna go into it. Instead of backing up and asking a few questions first, instead of just jumping in head first, that'll help you get a little bit more of a path.
Yeah. So, if you're going to have a birth in a birth center or at your home, you won't have an epidural. And that is one of the 2 big things that lead to people choosing a hospital birth in the first place. And so, as part of being able to go through that process and not coming away really unhappy and really upset about your experience, is digging into some resources and learning about what does birth look like? Even if you have had a hospital birth, even if you had a hospital birth maybe without an epidural or, XYZ, it's going to look a little different at home or at a birth center.
And that'll happen, and it'll be good. And as long as, and their midwives will be able to go through all of that.
Yeah.
And that's the beautiful thing here. So just recapping a little bit before we end, because I want to make sure that we get, going. with everybody having kind of what they need to know. Your feelings are valid.
Yeah.
Have these overwhelmed moments, you're going to have these times of uncertainty, and they might be a little bit heightened right now, and that's okay. They're totally and completely valid. Okay. The current changes that you mentioned, you know, it might be one person's allowed in, it might be nobody's allowed in, it might be, you know, providers are different or classified differently now. And that's just something that you probably need to be aware of. And then women, you know, now they're responding to those changes. They're like, okay, so what do I need to do? Do I need to do anything? And so just be able to take stock of like, okay, so what do you want? What are you able to do? Which is us into the next part that we discussed about, are you able to do something? Are you able to look at options? Or do you need to stick with the course that you're in right now?
I want to point out real quick.
Yeah.
It is possible. There are things that you can do. If you do need to stay the course, you do need to continue with your original plan. There are things that you can do to make your experience the best that you possibly can. I read a story yesterday about a woman who did have her hospital birth. She couldn't have her doula or her husband inside of the hospital, and she was able to make accommodations and do things and set herself up for success, and she had a birth that she's really pleased with.
And so that's awesome. It's possible.
Yeah.
It doesn't have to be doom and gloom. And it doesn't, you have options. And it's all about options, right? Like it's all about, okay, so I am going to stay the course. I am going to do this hospital birth. How can I make this amazing for me? I love that.
Yeah.
And then once you've decided, you know, reach out to people. Knowledge is power. So making sure that you're educated, you know, be heard by your providers and be told, you know, this is something that's going to be great and we're going to make this, you know, work. And then ask several different providers and reach out to the community that you're in. That's going to be the biggest thing. Any parting words for people as we click off of this?
Man.
I know, right?
If in doubt, reach out.
No, right? Like when in doubt, even you, like, because reach out to Kelly, because you'll probably know somebody who knows somebody, and that's the great thing about having a community of people behind you. You're not alone. So
yeah, you can set yourself up to have success and do everything and really offset. I saw that really offset some of these changes, and there are things that you can do. That story that I just told you, she labored in the parking lot in her car with her husband and her doula until it was like time to push. It was in game. Yeah. and then she went into the hospital and she had them on the phone, and so she
That's
really
awesome.
she you know, learned her options and figured out and worked around her obstacles and figured out how to make it work for her.
So don't give up. It'll be good. That's awesome though. I love that story because then it's, I mean, there's options. There is things that can happen and it can still be a great birth for you.
Yeah.
Don't get discouraged.
And there are things that you can do after the birth to help process what happens. So, you know, like pre-birth, you can, you know, talk to a counselor and kind of process your feelings or talk to whatever, process all of that. And then, you know, you go into the birth, have that, everything that happens, and you can come out on the other side and you can still get professional help to process those thoughts and those feelings and those events. I know some really great doulas who have a special service. It's called Birth Story Listening, and they are professionally trained. They're not therapists, but they are professionally trained to help you process your story or what happened and how to really come away from that.
Maybe we need to have a whole conversation about that because I think that that would be really, really great because there's going to be a bunch of people who can't access the other options. So yeah, let's do that for sure.
Yeah. And
but
get
I hope
that,
that this is helpful.
Yeah, that postpartum support and, you know, the challenges with that with social distancing, but there's stuff we can do, and there's stuff we can do postpartum to really support all of that.
That's awesome.
Another conversation.
No, that's a great point. Yeah, no, that's a great point, and it's truly needed. But yeah, no, thanks for this conversation. Hopefully this helps everyone here, and I know it's helped educate me, and hopefully this educates you as well. So thank you, Kelly.
Thanks, Cassie.